I probably wanted to be a hair restoration surgeon about a year after having my first procedure because I couldn't believe the results. Although I had some pluggy results in the first one, I was still amazed by the ability for hair to move from point A in the back to point B up front. That's really when I realized the power of hair transplants and how it can change your life. I've been doing this since around 2004, 2005, and I've had many really great instructors over the years, people who've trained me on how to do this to get to where I am today. I am a board certified hair restoration surgeon through the American Board of Hair Restoration. I'm also an active member in the International Society of Hair Restoration Surgeons. I wouldn't have been in hair restoration had I not been a patient. So people that get into who aren't patients, although they might think that they can do a good job, they're never really going to understand what it feels like to have hair loss. How can they? So number one, I am a patient, so I understand your needs. Number two, I am highly experienced to be able to do this. I've been doing this for a long time. I've seen almost everything out there, and although you still learn as you go forward, I've seen a ton, and you get really good at anything when you have a lot of experience. You can't just do it for a couple of years. You have to have at least 10, 15 years of experience to really kind of hit your stride and completely understand what you're doing, and you still grow. Ideally, in a perfect world, I would see all bald patients 35 and above because they don't have any hair, they're not going to be losing any more hair, and we're going to go in forward territory. But life is never that easy. So I get people with varying degrees of hair loss, varying ages. But my overall philosophy is to try to be non-surgical first with patients, especially the younger ones, because active hair loss seems to be somewhere from the teens through like the mid-30s, at least in my experience. Although hair loss is progressive for your whole life, typically starts slowing down in the late 30s, 40s, and 50s and beyond. So with young patients, I have found out sometimes you do a really nice job, but they're still in the middle of their active hair loss, and a year later they come back and say, "Doc, it doesn't look much different." So when I have a young person come in, I try to talk about non-surgery. What makes my career rewarding? Seeing a patient come back in 12, 15 months and saying, "Doc, thank you very much," and sometimes seeing tears in her eyes. This is a very emotional experience to go from someone who may be very thin hair or losing hair and they're stressed out about that, and seeing them 12 months later where they come out looking great. And it's rewarding when people come back and say, "Thank you for changing my life." That makes it all worth doing. Being a hair restoration surgeon is all I could ever imagine myself doing. My only regret is that I don't have about 1,000 years to do this because I love this. This doesn't work for me. I haven't worked a day in my life since 2004, 2005. It's all I do. It's what I do exclusively, and I think I'm one of the best at it. And as far as a passion, there's nothing more that I'm passionate about except my family. My family first, and then hair restoration surgeon. I could do this forever. I could do this 7 days a week if I didn't have a family, but I think my family would like it too much. But I do love this. This doesn't work for me.